Good afternoon, everyone. My name is Dr.Kristina Sule. As you've heard, I'm a consultant obstetrician, a general and a cosmetic gynecologist. I run a private practice called Alora Medical Practice. And this is a topic very dear to my heart. You'll soon find out why. And it's something I do love to talk about. And I like authenticity and clarity and being real. So maybe this, is also a commitment to be healthier. Yeah, not just talk about health, but actually to be healthier. And I'm so glad I get to talk about this with an institution that is also very dear to my heart, Nairobi Bariatric Centre, with people who are dear to my heart as well, Dr. Shukina and Anastasia. We are country mates, don't ask how. And yeah, so I hope you guys enjoy this. I don't have a presentation, but I'll talk from notes that I made on my phone. Right, and what I'm going to talk to you about today is about the role of obesity in reproductive health. Yeah, how does being obese affect you as a woman? And seriously as a woman, and not just about you can't get a date, but seriously, how does it actually affect you? So I'm gonna start all the way from adolescence. And the first thing that obesity does is that it changes the timing of menarche. Menarche is when a girl starts her first period. So girls who are obese tend to start their periods much earlier and go into puberty much earlier than girls who are within normal BMI. And this is a problem not just medically but also culturally, because then they look more mature and then they look like they're actually, sexually active even when they're not. And this could bring about a lot of self-esteem issues, but at the same time it could bring about medical issues because they do start their period, and when that period starts it becomes irregular. So they're not going to start off a normal period, but they're going to have an irregular period. And that again is something that's going to affect their reproductive system, but also affect them psychologically. So they get something that we call secondary amenorrhea. So they go long periods without having a period. And then when it comes, they bleed for very long. And then it goes away again for the longest time. And all the while they're gaining more and more weight. They're gaining height. They're getting breast development, which at that point in time, they're really not ready for. Maybe they're 8, 9 years old, 10 years old. It's just not the time to, have that kind of development. And in medicine, and because I'm a scientist, we do studies, and the highest level of studies are what we call randomized control trials and meta-analysis. And they are randomized control trials, and what that means is that we put people in different groups, and we do one intervention to one group and a different intervention to the other, and then we compare. So there are randomized control trials that have been done for girls who are overweight, and to monitor their menstrual cycles, and girls who were of normal weight. And the overweight girls had more menstrual irregularity than the girls who were of regular weight. So you can see that obesity is a problem that starts very early. By the time a girl starts her period already, obesity can significantly contribute to her well-being. Studies have also shown that women who are obese experience more period pain than women who aren't. So that's dysmenorrhea. They experience more of PMS. All right. And PMS is real. It's not just you going crazy around the time of your period. It's actually a hormonal shift. And women who are obese experience more premenstrual syndrome symptoms than women who are of normal BMI. Also, women who are obese tend to experience heavier menstrual bleeding, and I'm going to get into that shortly. But as you can already see, weight is significantly contributing to how you experience womanhood, right? Now, one of the things that I like to talk about a lot is polycystic ovarian syndrome. I had polycystic ovarian syndrome from a very young age, and so that's why I, talk about it freely. And it's a very trying I don't have it anymore, just mentioning, but I used to have it. I feel like it makes things better because it makes me more empathetic to my patients, because I've actually walked that journey, so I know what that's about. And weight did contribute to that a lot. I was much heavier then. And with polycystic ovarian syndrome, we call it an endocrinopathy. And I don't like to use fancy words. I like people to relate to what I'm saying. But basically what that means is that your hormones are not doing what they're supposed to do. But the major thing about polycystic ovarian syndrome is something called insulin resistance. Your body does not know how to handle insulin. And when that happens, you go into a vicious cycle of your body not knowing how to process insulin, not knowing how to process carbohydrates, making you gain weight, not processing the insulin some more, and you wonder at what point does the person leave that cycle. All right, so it makes you wonder. And by the way, polycystic ovarian syndrome comes with a certain reproductive challenge, so there is infertility associated with polycystic ovarian syndrome. And so it's kind of like the chicken and the egg. So is it that infertile women are obese, or are obese women infertile, or both? Right? And so weight does significantly contribute, because the higher your weight, the more chances that you get PCOS, and then you get insulin resistance, and then from there it becomes difficult to leave that cycle. And actually the break in that cycle comes with weight loss. And several studies have been done to show that women who lose even just up to 10% of their weight, just up to 10%, have significant improvement in their PCOS symptoms. And the symptoms are abdominal weight gain, so around the center. So, your legs could be, fairly skinny, and your arms, but you get a lot of abdominal weight gain. They get acne, they get balding, they get irregular periods. And the reason why they get all of this is that with the weight gain, they get a condition called hyperandrogenism. And what that means is that you're producing more male hormones than you should. And with that, your periods become irregular, because your body knows, well, men don't menstruate, so I'm going to stop this process, because we're basically in the process of becoming more manly than we should be. Your testosterone levels go through the roof, and of course that causes mood changes, but more importantly, it causes infertility, because your body stops to ovulate the way it should. So your ovary, being polycystic, means that it has so many cysts, and each of those cysts are producing loads of hormones, and that causes a general imbalance. And that imbalance leads to no ovulation, and no ovulation equals to no conception. And that's the major problem. But other than that, women who have polycystic ovarian disease also experience rise in other hormones. Thyroid hormone, prolactin, being a hormone in your brain that tells the body that it's time to breastfeed. And during breastfeeding time, it is time for you not to have your period. So once again, your period shuts down. It's the time when estrogen starts being produced to a high extent as well. And when that happens, you get a condition called endometrial hyperplasia. And that means that the lining of your uterus gets so thick, and in the moments that it's taking you to build up that super thick lining, you're not having a period. And then when your period comes, it stays forever, because you're trying to shed a lining that's 3, 4, 5 times thicker than what a regular woman has. So no periods for 3 months, and then bleeding for 30, 40, 50 days. And that's actually what I was experiencing when I was 18. Of course, I wasn't a doctor then, so I had no idea what was going on. But I can tell you, nobody wants to bleed for 40 days because of weight. All right. Now, endometrial hyperplasia, this condition that I'm describing, is actually a risk factor for endometrial cancer. And I'm just about to go into how obesity leads to reproductive health cancers as well. And I'm not even talking about other cancers. I'm talking about now reproductive health cancers. But before I get into that, obesity also leads to metabolic syndrome, which means our cholesterol becomes increased. We get high glucose levels, which leads to more weight. So weight leads to weight. It's so sad, and it sounds so horrible and desperate, but weight leads to more weight, which leads to more weight, which leads to more weight. So weight loss then is the solution to all of these issues. And this could, of course, impact your cardiovascular health. So the risk of heart attack, the risk of stroke, and even the risk of low self-esteem and mental illnesses such as depression, because the truth of the matter is nobody wants to be overweight. Nobody wants to be carrying 20, 30, 40, 50 extra kilos of weight. Nobody wants that. And that could significantly affect how you view life, how you view your own capabilities, even as a woman. It can affect the kind of relationships that you get into. So you're more likely to get into more abusive relationships with male partners. And these are studies that have actually been proven. All right. But now let's actually get into infertility. How does obesity cause infertility? So One of the ways is through polycystic ovarian syndrome. Remember, you're not going to ovulate. But even with endometrial hyperplasia, remember I said the lining of the uterus gets so thick, and that lining is not conducive for implantation to happen. So once again, infertility will progress. Now, infertility and obesity has really poor outcomes for women who try natural conception, but also women who go through IVF. Meaning, if you're obese, whether you try to conceive naturally or you try to go for IVF, your outcome is going to be poor as opposed to a woman who's of normal BMI. All right. And the women who are obese also tend to experience more miscarriages, either through natural conception or through IVF, compared to women who have a normal BMI. Now, when women are obese, they also get a lot of pregnancy complications. So let's assume they somehow manage to get pregnant either naturally or through IVF. They experience higher rates of miscarriages. They experience higher rates of a disease called gestational diabetes mellitus, meaning they're more likely to become diabetic, not just before pregnancy, but during pregnancy. And when they're diabetic, even before the pregnancy, during the pregnancy, their diabetes can get even worse. All right, so it can be compounded by the diabetes that's brought about through pregnancy, and that becomes very difficult to control. Now, where my patients don't like to hear that is when gestational diabetes affects your baby. So it can lead to serious congenital anomalies of the nose, of the spine, of the heart, of the kidney. So your baby could actually be affected by your weight. And if that's not a reason enough to lose weight, then I really don't know what else is, right? Now, women who are obese also tend to have higher cesarean section rates because they're not likely to deliver naturally because of their obesity. They're likely to go into obstructed labor. And when they deliver via cesarean section, they're more likely to get postoperative complications like infection and just poor wound healing because of the obesity. And this is just because the wound area itself doesn't get access to oxygen, doesn't have a good supply because of the flap of fat that's there at that point in time. So already they had a cesarean, which maybe they didn't want, and now they can't even heal from the cesarean or take care of their baby, who may have a problem because of the kind of pregnancy that they experienced. And last but not least, cancer. So how obesity leads to reproductive health cancer specifically is women who have high BMI have a high breast mass, meaning their breasts are likely to be bigger than women who have a normal BMI. High breast mass is a risk factor for breast cancer. Believe it or not, if your breasts are much, much bigger, you are at a bigger risk of breast cancer than women who don't have a high breast mass because their weight is much lower. So breast cancer is a risk. As I mentioned, endometrial cancer is a risk because when you're obese, you produce lots of estrogen and it makes your lining of the uterus grow thick, and sometimes that lining starts to get thick uncontrollably, and uncontrollable cell growth is cancer. So endometrial cancer is another risk. And also women who are obese are at risk of colon cancer. All right, because the kind of food that you're eating is likely to be cancerogenic, something that's not good for your GIT. All right, so several reasons not to be overweight, especially for your reproductive health. I mean, your health in general, but your reproductive health much more. Of course, men are not going to go through any of these things. They do face certain fertility challenges. They face libido issues, but this is what women want conference, not what men want conference. So we're going to talk about how women are affected. And I hope that kind of gives you a scope as to how damaging obesity can be. But not just how damaging obesity can be, but how weight loss can change a lot of things for your reproductive health as well. I hope this has been informative to you. Thank you so much for listening to me.